gives me great pleasure to introduce Dr. m.head and Jess Boxall, who is, where's she gone? Oh, there you're hiding, yes. And also from Ghana, Kirchuffs Atengble. Close, near enough. So Kitung he's the executive director of an organisation called Pax Africa, which is a youth-led Pan-African think tank, and so he's the feet on the ground in Ghana, who probably plays a role in making this research happen. So Michael and Jess are going to talk about the impacts of climate change on Ghana, and also the implications for the UK. Fascinating aspect, which I'm certainly waiting to hear about, and I'm sure you are too. So over to you, Mike.
Thank you very much indeed, John. Thank you to everyone for coming out tonight. If there are people at the back who can't hear what I'm saying, then you probably are among the privileged few, I would say, so relish that moment. So yes, I'm m.head from the University of Southampton. I'm based in the Faculty of Medicine there, and global health is my area of research, and as John mentioned, Ghana is one of our main countries of focus. A lot of our research covers sort of public health policy, that sort of area. We started to look more in the last few years at the links between the climate change and health. We're more from the health spectrum than the climate side, but we'll try and do our best to answer any questions around any environmental factors. I'll just hand over to our colleagues just to briefly introduce themselves to you, and then we'll get started with the presentation.
Evening, everyone. My name is Jess, and I'm also a researcher at the University of Southampton. I'm also a nutritionist in public health, and my research areas are more around women's health and food insecurity, which I will show you a few case studies from today.
All right, thank you. So I'm Kirchuffs Atengble, as introduced, executive director, founder, and executive director of Pax Africa. I have my master's from Manchester. Yeah, but then we've been doing this with government agencies, working with government agencies, trying to help them make better use of research and data, for the policy purposes. And we've been doing that for over 7 years now. But in Ghana, we've been working with Mike and Jess and the colleagues from the University of Southampton on the different interventions that they have on the ground research-wise. Thank you.
So this is Ghana, basically. It is a very bright, colourful place. You could have come wearing your Ghanaian shirt, Kirchuffs. I suppose we could have done as well, actually, just to show you some of these beautiful colours. So I think particularly with some of Jess's slides later on, we'll see a bit more of the scenery of Ghana. And this essentially is our talk. We're going to talk a little bit about sort of climate change and healthcare more generally. And then we're going to move on to some case studies and some examples of our research looking at food insecurity and the role of women's health and some other aspects like that in terms of how that impacts upon climate and health. That'll be the kind of the rough outline of the talk. Just kind of one brief slide at the start on kind of why it's extreme weather patterns, inconsistent weather patterns, which is kind of part of the problem really when it comes to managing people's health. If you have, for example, predictable flooding, rice and paddy fields kind of rely upon predictable flooding. That's how we get the rice here. It's the kind of inconsistent patterns and also the more extreme weather events that is part of the problem. So we have more extreme heat and extreme cold as well, actually. But we have either no rain or too much rain quite often. And some of these aspects lead sort of into different areas of health, some of which I'll go through now. But in terms of the UK, this is also one example from the UK. We have kind of increasing temperatures here in the UK, which will impact upon us with the heat, and some other aspects as well that I will talk about. So in terms of why we should care, there's a few various reasons why. So one of the reasons why John got us here today is he read this article on The Conversation. Happy to make these slides available, John, if you so wish, so people can have a look if they want to. where we wrote about this, where we picked some of the 5 key ways that climate change will threaten human health. This one I will cover in a little bit. Don't expect you to read the text, but we're talking about new and emerging infectious diseases, many of which will be kind of mosquito or insect-driven, essentially, and I will come back to that in a moment. But also pandemics as well. As people move around, as animals move around, as kind of weather forces people to migrate a bit more, then again that sort of changes the dynamics and overall increases the threats, particularly in terms of moving humans and animals together. Most of the sort of funky new infectious diseases we get typically do jump from animal species into human species. Bats hold a metric ton of viruses. So the more we kind of move into, for example, a bat's territory, the more risk there is that a new virus will come into the human being. There's also food security and nutrition. Jess will cover that a lot more later on. But ultimately there are various predictions that over sort of the next decade or two that many, many hundreds of millions more people will be at risk of malnutrition and hunger than they are at the minute. And access to healthcare is one that I am particularly interested in through some of my research. It's not necessarily one you think about, but physically being able to get to a health facility is a key one, really. I'll show you in a minute one or two examples from Ghana, but again, if there is flooding, the road is closed, so you can't get there. If there is extreme heat and you've got a 3-hour walk to the hospital, then you may or may not make it there. These are the scenarios that many people around the world will face. And I think increasingly such issues, possibly less dramatic, but will come into the UK as well, in terms of sort of damage to infrastructure and the healthcare that it is possible to deliver. And things like air pollution as well is a big thing. Air pollution is responsible for many millions of deaths around the world typically. Including 36,000 deaths a year in the UK as well. So again, with worse air pollution, there is more early and preventable death as a result of these sorts of things. And we also looked at extreme heat in this article too. I was telling one or two people just before the start of the talk that a friend sent me a screenshot of the temperature from Ghana, from northern Ghana, where it's especially hot. The screenshot had 43 degrees C, feels like 55, was the summary there. So you can't do much in that temperature, let alone walk to a health facility or pretty much anything else. If you're working out in the fields, there's a lot of agriculture, a lot of subsistence farming, then it's just extremely unpleasant and frankly unbearable. This is one example. Dengue. It's a mosquito-transmitted virus. It's extremely nasty, but it is increasingly common in Europe, and it's heading north, basically. It's more common in Asia and, to some extent, sub-Saharan Africa. But we do see regular outbreaks in France, and other parts, in particular of northern Italy, are very adept at holding some of these mosquitoes. And there's another one called the West Nile virus, which is similar and quite very unpleasant. Has a mortality rate of a few percent, with no vaccination, for example, and no real treatments. So these mosquito-related diseases, and malaria as well, are increasingly becoming commoner in Europe, and that is predicted to continue as we go through the decades. Dengue is an interesting one from a perspective of an infectious disease scientist like myself. The eggs are extremely hardy and will last a long time. You can easily have some mosquito eggs laid, and then a year or two later they are able to hatch and the mosquitoes emerge. And also the mosquitoes that harbour the dengue virus are a bit different to the ones that have malaria parasites. The malaria parasite mozzies tend to hang out at night, which is why you have bed nets, for example, and they're very effective. But the dengue mosquitoes are around in both day and night. So that is much, much harder to protect yourself from. And there's this one as well, this rather hideous-looking beast. That's a tick. The Crimean Congo hemorrhagic fever. As you probably can guess, if anything's got the word hemorrhagic fever at the end of it, you don't really want to meet it. That's got a mortality rate of about 50%, give or take, similar to Ebola. And it's mostly in sub-Saharan Africa at the minute, but again is spreading and spreading north, including some of the birds that will migrate from Africa to Scandinavia at different parts of the year. So there are risks, and it's typically animals like cows and horses that will harbour these ticks and then potentially come into contact with humans. So the birds come north. If they have contact with any of these animals, there's a possibility that they may transfer the tick, and then over time there's a possibility that the tick may become sort of embedded in the local ecology. So these are some of the risks that climate change is enhancing and making more likely to happen at some point. Africa is the continent that is already probably arguably sort of most experiencing the current impact of climate change, and will be the continent that is most affected by it. Again, don't worry too much about reading the small text, but this is yellow fever, another mosquito-borne disease. And the various sort of modelling exercises that have been done by scientists suggest that climate change will make yellow fever worse, with increased deaths over the next, up before the year 2050. And it doesn't need to be, because there's a very, very good vaccine for yellow fever, which entirely prevents it. But difficulties with access to healthcare and delivering vaccines, combined with the movements of these mosquitoes and new habitats, kind of create that perfect mix for these diseases to thrive. And this is from, there's a sort of a big medical journal called The Lancet, and they do a commission every year on climate change. And that box at the bottom, which I'll read for you, Africa has suffered disproportionately from the climate crisis, although it has done little to cause it. So they are suffering the consequences despite being not exactly the protagonists of climate change. This is a study that some Southampton colleagues and Ghanaian colleagues did in Ghana, where they looked at flooding and the impact of that on diarrhea cases at local health facilities. The dam-mediated bit, so in Ghana, Burkina Faso borders it to the north, and there's a big dam in Burkina Faso, which basically fills up every year, and they literally pull the plug out so it doesn't overflow. But that then floods northern Ghana. It's actually now I think a coordinated activity between the two countries, isn't it? So northern Ghana kind of relies upon it a bit for growing some crops at that certain time of year. But it does cause obviously a lot of health problems, including, for example, diarrhea. A lot of the rural communities won't have flushing toilets like we do. So when the floodwaters come in, then all the effluents wash back into the village. So among the results that they found, the incidence rate ratio, 4.27, basically 4 times more likely to have diarrhea at the time of the flooding than not, essentially is what that's telling us. But one of the most interesting aspects of this study, and this does get a little bit sad at this point, one of the things they noticed was that health staff can't get to health facilities to open the health centre. It's not just about the person who is sick getting to a health facility. The healthcare worker might live in the town just over there, but it's flooded, so they can't get to this health centre here to open it. Now, when a mother with a sick baby walked through the floodwaters to take their sick baby to the health facility, found it shut, couldn't get it seen to, walked back through the floodwaters and dropped their baby in the floodwater, and it drowned. That is one of the impacts of flooding like this, and it is stories like that will get worse with climate change as unexpected and worse flooding happens. That's kind of the real consequences of it. I'm a quantitative scientist, so I look at data and numbers on a spreadsheet a lot. But if I look at mortality rates, behind that is, for example, that mother who's lost her child. That's the kind of story I try to remember when I'm looking at my number crunching, just to try to remember the people behind it, because that is important. So as part of our sort of research and also our activity, we got a small amount of money to run this summit in West Africa last year that we ran with Kirchuffs and Pax Africa, with the Ghana Ministry of Health and ourselves and a few other colleagues at University of Southampton. And we had various attendees from a few different African countries, from Ghana, from Benin, from Ivory Coast, from Nigeria, all of these West African nations. And we also had the scientists there, the people from the health ministry. We had a lot of civic society and charities and NGOs who again work with the people on the ground who are experiencing climate change, so we could get their stories and hear them. And again, I won't cover this too much. I think Kirchuffs will cover the summit a little bit more detail later on. But also some of the key themes involve getting high quality data. Better coordination between subject experts was one thing, because climate change needs environmental people, it needs kind of public health people like me. It needs the social scientists, the laboratory scientists to all to club together a little bit more. So kind of joined up approaches to working. We all work in our own little silos. It's a lot harder to work together. So that was one of the key messages. And also locally led approaches. So hearing the voices of the rural communities that are affected by the flooding. And that's one of the things we have tried to do in our research. And again, something that Jess will talk about a bit more later on. So there was some lively panel discussions. That's me on the right-hand side, and I think Kirchuffs is second from left in that picture. So we had these panel discussions. My honourable colleague here, Jess, is presenting. And also, again, we had sort of further panel discussions. Essentially, it was a really, really good event, I would say. There was lots of invigorating, inspiring presentations. I gave a presentation which I think was invigorating and inspiring. And just to prove it, look at Jess's face there, basically. We probably should try and recreate that photo tonight. You come stand behind me in a minute and just look bored. Anyway, that's what we did. We did a summit just to kind of bring the policymakers together. And this is I think my final slide, Jess. So you need to compose yourself, all right? But this is one of our ongoing studies that we have in northern Ghana, where we are looking at, again, the impact of climate upon health. We're working with several rural communities to understand their viewpoints and how they might best deliver health messaging around different areas of health. One of my areas of research is neglected tropical diseases. The clue is literally in the name. We're including things like sort of scabies and leprosy and other kind of nasty skin infections like that. So we're trying to look at access to healthcare, what we call healthcare seeking behaviour. Can we get people to go to a health facility before their disease gets too serious, that sort of thing. And then take into account the impacts of climate change upon that decision making. This is a picture of myself and Victor. Victor is looking far more pleased to be next to me than Jess was in that previous photo. But yeah, that's it. Professor Victor Mogray, who is at the University for Development Studies in Northern Ghana. He's our collaborator there. So I think that is me done. So we're going to hand over to Jess to talk us through some of our research in Ghana. Thank you very much.
Thank you. I promise I do really enjoy my job and the research that we do, despite...
Can we change your microphone?
Yeah, of course I can. Okay. Despite being caught in that unfortunate photo, which he managed to sneak in without me realising in this presentation. No. So yeah, as Mike said, we're going to touch on a few case studies that we have done. This first one being a study in Mion in northern Ghana, where we were looking at the impact of climate change on food insecurity in this community. Was that in the way? So in 2021, globally, there was about 1 in 3 people that were experiencing food insecurity. And this is on a scale from moderate, maybe being anxious about where your next meal might be coming from, or if you've got enough to feed the household, and reducing your kind of quantity or quality of your diet, all the way up to what we'd class as severe, where you and your household may not have eaten for about 24 hours, you've gone to bed hungry, and you really do not know what the possibility is of how much food and when you will be able to get hold of it. And we tend to split this into 4 different, we call them pillars. So the availability, accessibility, affordability, and how you can use food as well. Because sometimes when we think of food insecurity, it can be very much from just maybe in the UK an affordability angle where people would access food banks or food vouchers or such things. But there's many different things that play into our ability to get food, to afford it in the first place, the food that is there in the shops, thinking of like rationing that we've seen in recent years of like eggs and similar foods, or even if you've managed to bring your food home. Another thing that we struggle with in the UK can be things like fuel poverty, so people being able to cook their food, or in other developing countries possibly the use of safe water to wash and prepare your food as well. So there's lots of different things that play into this. No, go on.
The speaker has failed at the back there. If you can hold it a bit closer to your mouth.
Okay.
Just make it hold the people at the back.
Fine. Just tell me if I get too close to it. So climate change therefore brings a lot of consequences to all these different facets of food insecurity, and the ones possibly most pertinent to rural Ghanaian communities are the loss of crops and livestock from flooding or droughts, and not expecting extreme rainfall, or expecting and it's not coming. So the rainfall in the last rainy season wasn't as expected, and parts of Ghana are now facing quite severe imminent famine. Soil infertility after extreme flooding can also be an issue with the nutrients in the soil. Pest and disease outbreaks, as Mike's touched on, with a lot of the different diseases that are going to be coming up between animals and therefore livestock, or even ones that go between crops and can absolutely devastate a harvest. Transportation issues, again we've touched on some of that with the issues of the extreme heat on the roads or the flooding. If there's one road into a community where you would be able to access it for the market for food, and that's impassable, then what happens next? And this is obviously going to have a huge effect on the market prices as well. And that's something that we see globally. So there has been a lot of modelling done on the climate change induced inflation on food in the next few years. And that's not going to just be countries within Africa, that's going to be countries across the world, including us. Foods that we rely on from other countries, whether it be olive oil, coffee, chocolate, it's all going to have a huge impact on what we see in our supermarkets. So, as Mike's already said, countries in Africa are going to be the hardest hit by these issues, and Ghana is a hotspot for this because it is so dependent economically and for people's income and for their own food, and everyone's dependence on rain-fed agriculture. So the temperature's increasing, and then the extra things that northern Ghana faces that southern Ghana doesn't. So lower levels of development in the northern part of the country, higher levels of poverty, and more climatic hazards. So obviously the temperature, as we've already discussed, is a lot higher in the northern part. So I've already sort of explained this, but this is the Food and Agricultural Organization of the UN's definition of food security. So it exists when all people at all times have physical and economic access to sufficient, safe and nutritious food that meets their dietary needs and preferences, and that includes cultural differences as well, so that every country has access to their culturally appropriate traditional foods for every day and for feasts and festivals as well. So for the study in m.head, we did a mixed method study where we did household surveys and focus groups. And we were looking at the knowledge, attitudes and practices surrounding climate change, health and food security. So for this we trained local data collectors in the community up to be able to complete the surveys for us and collect the data. And this map just shows you within the northern region at the top where m.head sits. So we were asking questions, just basic demographic questions to get a feel for the context of the community. You were asking them a validated food insecurity measure, and this allows us to measure it in a percentage prevalence of moderate and severe food insecurity, so we can compare it a lot across lots of different places within Ghana and regionally and globally. And also we asked them some questions around their health and how they felt about this. So we had almost 400 participants. And we use the random walk method because it's not always very obvious you can't always very obviously map a community in kind of random sample. So for some of these studies we were literally asked the data collectors to spin a bottle or a pen or something on the ground and then follow that route and say like every 4 houses then please ask them the survey. So move on to some of the results. So demographic-wise, the mean age of the survey here was 47 years, and most people, about a quarter, were 40 to 49 years old. We had about 60-40 male to female, which was really good. And as is possibly expected for these communities, around 80% had had no formal education across their lives. That's including no primary and up. 92% reported main income from agriculture, so this could be on their own farms for subsistence farming, so they rely on this for their own income and food, or it might be working on labouring on somebody else's farm. And around a third said they were unemployed, 2/3 self-employed, but we also understand that there's a difference in understanding between like working on your farm and whether you class yourself as un or self-employed. And the mean household size was obviously a lot larger than we'd normally see in the UK, so it was 11, but it was up to 35 people in one household. So here is a table showing so we've got m.head, which is our sample that we've looked at here, then Ghana, West Africa, and the global percentage prevalence of moderate and severe food insecurity. So for moderate or severe, we had 62% of people that answered the survey were food insecure, and 26.4% were severely food insecure at the time of asking for the survey. So these households were the ones that would have gone a whole day and night without eating. Much higher than Ghana's national percentages, which does show the difference, as I was saying, between the north and south in terms of development and poverty. It's about the same as what the FAO have data for West Africa, and as to be expected, much higher than the global percentages. So when it came to asking people about the impact of climate change, on their households. 94% reported that their food insecurity were getting worse over the last 5 years. Everyone bar one person said that climate change was negatively affecting their household food supply, and this was mainly because of availability at markets, ability to get there, and affordability issues as well. 63% ranked themselves as healthy on some level, and around a fifth reported that they had significant health problems. And we also found that a large number of this population had not been able to access healthcare when they needed to because of extreme weather events in the past 12 months, I think it was. Around 3/4 felt that climate change had already made a personal difference to their health as well. So we also did some regression models to look at what the impact of these different demographic factors had on their food insecurity score, as it were. And the statistically significant ones were 20 to 29-year-olds, larger households, and those who are unemployed were more likely to be food insecure. And it was quite expected around the age, because within large households especially, the eldest and also the youngest and those working would be prioritised before necessarily kind of young adults. But the most interesting finding that we had was that knowledge of self-reported, I should say, knowledge of climate change and people's confidence in what it was and their understanding of it and if it was real had seemed to have an effect on their food insecurity score. So those who were more confident in what it was and that it was real actually were more food secure than those that weren't. And we think it's possibly because if you are out on the farms, your livelihood and your food consumption is dependent on agriculture and things that are very exposed and dependent on the climate, then you are probably more in tune with what's going on, what's expected, what's not, and are adapting to that. So for the focus groups, I've just included a few of the quotes that drove home some of these messages. So one participant said, obviously the rainfall helps them grow crops for food, but this time around there's been no rain. So there's no rain for them to farm, and so no food for the children to go to school with. They're also very aware that this is likely to get much worse. So if climate change is not remedied, our grandchildren to come will face more challenges that we find ourselves today. Bless you. And the knowledge came up again as well. So knowledge is the key to everything. So I suggest we have a routine or monthly education on climate change and health. So these rural communities, despite that large proportion not having any formal education, are still very in tune with what was happening and what needs to happen to improve the situation. So some of the implications for future planning. So we know that these rural communities are more at risk. That means that they're going to need more emphasis and more help in governmental policies. We also should be aware that if their food insecurity is getting worse, there's also going to be much worse malnutrition. And if you're malnourished, your immune system and your ability to fight disease and that is going to be far more diminished. So you're going to be far more at risk of the diseases that might took us through at the beginning. So it's this never-ending negative cycle. And also, we always like to mention the Sustainable Development Goals. Obviously, we're meant to be heading towards the years of targets now, but Ghana is not set to meet any of them at the moment, and one of them is zero hunger across the world as well. So if we are to try and meet towards or make progress towards these targets, these communities that are most at risk are going to need the most prioritisation. So we always come with our recommendations at the end of the study, but also usually more questions, which will lead me on to the second case study to talk about at the moment. But one of the recommendations I wanted to highlight was under the policy interventions that I've included here for local sustainable action. So we see a lot of advertisement about food aid and that what happens around the world, and usually this comes in the form of very unvaried and kind of short-term solutions in food packages. But if we're seeing these patterns change and know that this is just going to get worse and it's going to be a year-round thing rather than just these spread out acute events, then one of the main things that needs to change to make sure that we're hitting all the facets of food security is that we have a long-term sustainable solution for these communities and not just very short-term, usually packages of cereals and kind of easy foods to store that don't need refrigeration or anything as well. So it's not going to be the healthiest, most balanced diet either. Oh, it's coming up again. So that is what makes food insecurity such a hard problem to address. We've got these 4 different pillars moving round, but just because you solve one doesn't mean that they're all coming together. So we need to make sure there's enough food available, people can get to it, they can afford it when they get there at the shops and bring it home, and then the whole household is able to eat a safe, healthy, balanced diet. So we had a few discussions during the m.head study with the Northern Region Health Directorate, who mentioned another district within Northern Region who have been massively food insecure for a number of years now, and despite a lot of these food aid interventions I've just talked about, nothing seems to be improving this situation. So we are moving to Carragher now. I say moving as in research, thanks to the Sustainability and Resilience Institute at Southampton for funding this. And this is a picture that one of the medical students has taken, who've just come out to Ghana, from the market within the Carragher town in this district. But we're changing tact slightly within this. So this is my new study that we're in the middle of at the moment. I'm working with both Mike and Kirchuffs. And for this study, we are going to be looking at the women's perspectives of food insecurity within this district. So they're the key decision makers of the household surrounding food. They usually make all the decisions when it comes to farming, how the money will be spent, how the food will be brought in and what's done with it, and who gets it within the household as well. But they're usually also the last to receive the food and last to be served. And I have a little bit of a bee in my bonnet about underrepresentation in research, and this isn't just applicable to women, this is also applicable to these rural communities that we're working with, because they don't have as much in the way of evidence base that then goes on to inform policy. And this is true also for lots of different minority groups in the UK and globally. But I am also especially passionate about women's health and their representation in research. So some of my, when I say favourite, I mean least favourite statistics when it comes to research, is that 5% of global research and development funding was allocated to women's health research or issues affecting women in 2020. I did also find out this week that there are more studies looking at men's baldness than a lot of women's reproductive issues. So, sorry, but that's also become a least favourite statistic. But this is kind of a multifaceted issue as well, because some of these the funding's either just not directed to women's health in the first place, or it might be and everyone can join, but there might be more barriers to women joining the study, or because of hormonal differences or cultural issues, they just don't make up as much of the population as they should when it comes to these studies. So when it came to designing the research for helping Carragher, I really wanted to know what the women thought in the community and what they thought would, A, is the problem, but B, is also the solution if they are the people making the decisions. So we're doing mixed methods once again, similar setup to the last time, but we're now in Pashigu in Carragher, which is showing in the top right, and that's about a 3-hour drive from Tamale, which is the nearest city and where the nearest tertiary hospital is as well, and not roads that are easy to get down either, unless we were in a very big pickup truck when we went in January, and even that was hard to reach it. So it's called SEED. Actually, no, this is correct. We have done all our initial work and we are now at, or just finishing, data collection. So we've done our focus groups, household surveys, and there's also a third strand as well that we're working with Kirchuffs on, looking at what the food aid interventions have happened in this space and why haven't they worked so far. But within this and setting up the study, it's really important that not only do we follow all of Southampton and our partnering universities' processes and that when we're setting up research, but also the traditional processes when it comes to working with these communities. So before we could go in and do any of the data collection, it was really important for us to visit the community and visit the traditional tribal chiefs and the community as well, and say what we were coming to do and was that okay, and get their consent as a community. So in January when we went to Ghana, we went out to Bashigu and we met with the tribal chiefs, and we sat in the chief's palace and we explained what we were there to do and asked if that was okay to come into his community and do so. And fortunately for us, he was really, really supportive of what we were there to do and recognised that research would really help with development, and we were there to try and help but with the community and do it together. So we had a Durbar, or community engagement workshop, but Durbar is the local term. And essentially we invited all the women in the community under a big marquee with a we were told that to expect dancing and drums, but we did actually turn up to a local DJ surrounded by goats under this marquee, which was a memory that will stay with me forever. And we went with a local NGO called Song Taba, who work to improve gender equality in Ghana and improve the rights of women and children, and do some really interesting stuff in dispelling witchcraft beliefs and that as well. So they were there to help us make sure that we were doing everything right, and they spoke in the local language along with the Kariga health director that came with us, and translated to the women, well, first asked their expectations of why we were there, and we got some really varied answers. If we were there to talk about teenage pregnancy and sexual health, so it was important for us to then say, no, we're here to talk to you and ask your opinions on food insecurity. We then asked them what they thought was the cause of climate change, and again got some really varied answers. That it was, despite understanding what it was, thought that it was caused by an increase in criminal activity or immoral acts, which is really interesting because when we asked Meon, they gave different answers. So we think it might be something to do with how many people kind of go to local towns or cities and exchange information, but it's really interesting to hear the different perspectives. We did have some dancing at the end, but the most important thing was that the community were really on board with what we were doing and were really enthusiastic about helping once we were coming out there. And that showed when we came to do data collection as well, because everyone that was asked was more than happy to participate. And we have seen in other studies as well that the households that don't get asked sometimes would like to know why they're not and would like to join in. So that's really reassuring. So I only have some very, very early results from this research because we literally finished within the last 2 weeks. But the mean age of this sample was slightly less at 39 years, and pretty much the same number. Of nearly 400 participants, 82% received no formal education. Main income from agriculture again, but we can see the breakdown here that 3/4 was from their own farm and about 1/5 was someone else's. 37% of the sample were pregnant or breastfeeding, or both, I should add. And again, mean household size quite large at 14, although we had up to 45 people in households this time. So from my very light touch initial analysis, these were the things that most stood out to me from the data that we have. So 65% of participants were scoring the most severe food insecure that they could on this scale. And within this, less than 2% of them had eaten any fresh fruit and veg in the last 24 hours. So mainly had starchy carbohydrates and very little protein. We had very mixed results on the self-reported health questions this time, and we asked about physical and mental health this time. So it was really interesting to see that differentiation. 68 participants had non-communicable diseases, so heart disease, hypertension, diabetes, but most of the population actually didn't know if they'd ever been diagnosed with any of the conditions we asked them about. And of these 400, despite them being mostly very severely food insecure, only 12% could tell us that they had ever received help from an intervention. Most of these, except one again, were from NGOs, not from any government aid. And again, most of them were short-term food aid packages and not anything that had helped them beyond a couple of weeks. So I don't know how big this is coming out. But we asked, what do you feel is affecting your food security negatively? And the top answer that came out this time was that they 84% cannot afford sufficient food. Nearly half said that there'd been a shortage of food items to buy, and about a quarter said that they cannot reach markets due to transport issues. I found this really interesting again as well, that once again we're seeing a very high confidence rating in their knowledge surrounding climate change and what it's caused by, if it's real again. Like much more so than any other answer. So as I said, Kirchuffs is helping us to do a review of what interventions have been done in Carragher, and has put together a database of these for over the last 20 years. So as this matches up with the survey then, we see the responsibilities mainly falling to the NGOs. There's some financial support from government agencies, but not so much. But the biggest issue that we found so far is that there's a real lack of evaluation of anyone being able to say that this was really helpful or not so helpful, and why. We also can't tell if they're reaching these communities that are further out from the main towns of the district. So we know that these interventions happen in Carragher, but did they happen in Carragher town in the middle, or did they reach these communities that are hard to get to and are probably going to be blocked off with any extreme weather events? So we are relying on district level monitoring data, but then also going to be a bit of a timeline match up to see if we can see if anything had any real impact. So finally, I just put some of our lessons learnt from doing this research with these communities together. Possibly the biggest being that the cultural nuances and traditional processes in the community matter just as much as our bureaucratic approvals. So you have to build these into your timelines. They're not an afterthought. They are imperative for you to be able to do this properly and with the community. And this takes some learning as well. So one of the things that the tribal chief said to us when we came to talk about the research, and we said about that we wanted to empower women to talk about their opinions, was that that's great. He's really happy that we're here to empower the women, but if we could just do it not too much, because women might leave their husbands and we might cause mass household breakdowns across the community. So it's really important. We can see that there is the opportunity there for gender equality and progression, but that must be within the constraints of the local culture. We can't come in with our Western ideas and demands that all the women just get up and speak their minds and leave. Not that that's what we were there to encourage them to do, but you've got to strike the balance. So it also doesn't come without logistical obstacles as well in terms of weather. So the study that Mike last referred to, we're having to be very careful with our planning with the intervention that it happens during the dry season, because once it comes to the rainy season, it would be too unsafe for us to ask participants or do any organisation in places that it becomes dangerous. The rains came when we did the first set of surveys for that study, and we were receiving pictures of data collectors going out in boats and like rowing out to communities that had been cut off from the flooding and things like that, which, if we were completely honest with health and safety at Southampton, might not go down so well. But it is, no, but it is the reality of what's happening on the ground and the point of why we're doing this research. So we just have to be mindful that we're doing it in the safest way. And the most important thing about doing this research is then that we take the findings back to the community, and that's something that comes up time and time again. It was something that came up at the Durbar, that they would find out what had happened to their contributions. And again, it'll be something that I plan once we've done the analysis and everything's put together, that we do make time to go back to the communities and we do show them what we've put together and what they have then ownership of. And then any interventions or anything that come out of this, it's led and designed by them, and they know that too. It's worth mentioning that there are also difficulties outside the communities when doing this research. So government changes, and when I wrote this was thinking both about in Ghana, because they've just had a government change in the last year, and sometimes you don't know what that will bring in terms of priorities or people changing over. But also overseas. So the US government changing has had a huge impact on research globally, and with US aid stopping, that's meant a stop to a lot of projects in Ghana, both research and interventions, which just makes life that little bit harder. But I think that's all I had to say on that matter. Before I go to the last slide, Kirchuffs, would you like to come and talk?
I think you can finish and
Yeah?
do some
Okay.
interaction.
That's all right. I need one more slide with the elephants, of my one of my favourite memories from Ghana. But thank you all for listening to us. I'll pass over to Kirchuffs.
All right. Thank you very much, Jess. I think she deserves a round of applause, right? Yeah, so these studies have been going on, and the questions, a key question would be, what does this mean to us, right? And I'm wondering what you're reflecting on. What's the implication? What can be done about this? Anybody with ideas? Anybody with ideas to share? What do you think can be done about this? Then I'll come through with what we have been doing on the grounds. But we want to learn from you as well, as experienced as you are. Yes.
It's a question rather than an idea. Is this informing existing government policy in Ghana, or is there no policy to inform? And if there is policy, what is it that's preventing the implementation of it?
That's a very good question, and that's where I actually would be coming to. But maybe I'll just address that. So I think Jess mentioned that after the study, they go back to the community to share with community people. And as part of the audience, I mean the gathering, the district officers, the director of health, and some local bureaucrats sit in there. But one important thing that we've been doing over the years, but not Karaga and Mion so far, is that we have created what we call the community of practice at the subnational level. We noticed that the way the administrative system is structured, government agencies like the Agric Ministry, the Health Ministry, they have their structures down at the district, the community levels, but they are interested in reports up to the center. But then these insights are not used at the subnational level, at the district level. So what we did was to create this community of practice among the government agencies at the local level, so that they share insights from their operations. So details like these that come from this report get back to them, and then the assembly has a planning unit that makes use of some of these things to inform its they call it the medium-term development plan, so that for the next 4 years they will want to integrate some new interventions that draw on some of these insights to see where to focus some new interventions in their own little budgets allocated to them for development purposes. So these are some of the mechanisms that we've deployed on the ground. I don't know if that's all right. Any other? Yeah. What can we do about this?
Yeah, I'm interested in the third bullet down, taking findings back to the community. This is a massive challenge, I would imagine. I mean, if you look at developed communities in the West, UK, France, Germany, America, our huge problem these days is polarization of opinion, political opinion, in our societies. And so I could envisage that if you formulate some programs and some very well-researched ideas as to how to move forward, you are going to have huge political challenges in getting those ideas across to the community. Half the community will say you're moving too far in a collective direction. The other half of the community will say you're moving too far in an individual, entrepreneurial direction. And if you're not extraordinarily careful and politically savvy, okay, your program is going to break down at that point. You need massive political skills. You need charismatic leadership, although charisma can be also itself very dangerous, as we are seeing in some countries. And you almost need marketing skills as well to achieve all this.
Yeah, that's very true. I think that's a very good contribution, because we experience those also. So it's not just in the US or in England or in France that these things happen. I think it's a human phenomenon that people have their own mindsets on some of these things. So by the time your findings are ready, they would expect that you engage them. But then you need to approach it from a sense of openness. It's not as though you are going to tell them what they should do. And so right from the beginning, the approach that this study uses, for instance, you involve them right from the beginning in conceptualizing the study. They train data collection people, for instance, from the community, right? So they can trust the process. And so whatever the insights that are coming from it, they can associate with. And so they sort of open to draw on these insights once they come up. So I think the political savviness actually also comes from this angle, that you need to engage right from the beginning. You don't wait and then go tell them that this is a problem, this is the solution, and this is how we should go. Oh, right. All right. Thank you very much. Any other? Yeah.
I quite often see and hear over here research into drought-resistant foodstuff crops and developing seeds. Does that migrate to Africa in the end, or is there a big cultural inertia to new, innovative, although climate-resistant product?
No, I largely we're open. Largely, we're open to new, innovations that will add up to solving problems that we have. But on particularly agricultural products, a big discussion is around GMO and conventional food stuffs, right? Some communities, especially those that are deep in indigenous ways of doing things, might be a bit hesitant because they have used their own technologies and it seems to work for them. And but even administratively, government of Ghana, for instance, has not closed the doors to GM stuff, GM organisms. And so it's just a matter of, like I mentioned, engaging. And then there are some trials going on with some GM products in northern Ghana by the CSR, the Council for Scientific and Industrial Research. They have a unit there called the Savannah Agricultural Research Institute that is doing some testing with field trials, actually, with cotton and rice. So insights from those, for instance, will inform government policy on how to deploy some of these things. So if there is any innovative product developed from wherever, it's just a matter of getting close, being transparent also in the how these were produced, and then they could be taken up. Yeah, thank you.
Thank you. Thank you very much for the presentations. Absolutely fascinating and horrifying in equal measure. We don't pretend to know about Ghana today, but 55 years ago we were living and working in northern rural Ghana, and I'd just like to pick on one of your statistics, which is the education. Only I think less than 20% having had formal education. It seemed to us at the time that every school, every village had its school, every rural town had secondary schools. There were children in their school uniform, boys and girls in their uniform, very visible in the villages. Have things really deteriorated since your parents' and grandparents' time? Has education really plummeted in rural areas? And that's one. I know I'm not allowed to ask two questions, but we were making maps for Ghana at the time, and we would be very interested to know if our maps from 50 years ago-ish have been revised and are still available and useful to you for this kind of work and all other?
Yeah, so that's a useful question, because schools have been there. New schools have come up actually. Even some we call schools under trees. So very often government infrastructure is not, budget for infrastructure development is not able to meet the demands. And so some communities, especially deprived communities, desirous of formal education, might want to start something. So they put up a structure, just get 1 or 2 teachers to start. Some might not even be trained teachers, but just to start somewhere. Possibly government would recognize some of these and then provide the needed support over time. So I wouldn't say it has deteriorated. I mean, over time, the challenge has actually been with access. That there are some households that still have children and would prefer to work with these children in other domains, right? Like in their fields, family farms. In the south, we have the problem of cocoa farms that some families would prefer to take their children, more like a generational business, right? They want to groom these children to become cocoa farmers as they themselves are. But what government is trying to do with time is to encourage them to allow these children to go to school, and possibly they could, still support the farms, having gone through formal education, learn a bit more, they can still get back to run these family businesses better. But so that's where the challenge more is, as in there are some other communities that are across along river bodies, and so they would want their kids to be helping with fishing and stuff like. So those are the peculiarities, but I don't think the numbers have been deteriorating. Population has also been increasing, and it's putting pressure on some of these facilities. So yeah.
I'm very conscious of time, and I think there are probably lots more questions. So what I'm going to do is suggest that when we break and go back to the back for tea and coffee, you ask your questions then, and you'll have a chance for a real good dialogue, because I think you've raised a huge number of interesting questions that are energizing all of us, and we'd love to hear about it. I'm going to hand over now to Phil, who I'm going to ask to give a vote of thanks.
Okay, thank you, John. I'd like to really thank our 3 speakers, Michael, Jessica, and Kirchuffs, for giving a very interesting talk. We've had lots of talks about climate change, and we've all seen lots of radio programs and TV programs and read literature, and we all thought we knew what was happening. We thought we were going to get slightly different climate, warmer winters, wetter, possibly drier summers in a more erratic way. And we knew that coffee and chocolate prices were going up, but we really didn't know the reason. But now we've got a whole new dimension added to it, because we know that out of Africa might come these pulsing waves of viruses and pandemics that are going to affect all of us in a new way that we hadn't really thought of before. And that African countries are going to face real crises which they are not used to, and which are a new dimension for them. And all of this, of course, against the backdrop of the New World Order, which is not going to help very much at all. We do now know the reason for some of the coffee and chocolate prices going up, of course, but really that's about the only good bit I could get out of the talk. So thank you really for giving us a real thought-stimulating talk there, lots to think about. I can just say we're sorry we haven't got any answers. It's a very complex problem. So thanks again for a great talk.
Here's what's coming up for you in the future. April 24th, ship navigation using pulsars. we'll learn what pulsars are, and we'll learn something about navigation, and maybe it's something that'll affect us all. Maybe we'll have pulsar navigation in our cars. Then May 22nd, the wonders of seagrass, the search for life elsewhere in the universe, and I can now confirm that that will be the date of Pushing Flesh on the Bones, examining the social lives of Neanderthals, will be July the 24th. And we have a September talk organised, only organised today, so it's not on the slide, and that will be about mending the ozone hole. We all know about the ozone hole. Well, we've gone some way to mending it, and hopefully we'll continue. So hopefully soon we will have a programme running all the way up to Christmas, and we'll hope to see you all here. Thank you all for coming. Thank you especially to our speakers for giving us a very entertaining and very informative evening. Things that we learn about at second hand, now we've heard at it first hand, and things that we should all worry about and be concerned about. So thank you for bringing all these things to our attention, and see you next month.